I'm going to go in for a second pass on this calf. Ooh. How's it right there?
Yeah, that's going to be intense.
Okay. Is that too much on your knee?
No.
Okay.
That's intense.
So if you try this at home, generally ankle, knee, hip, and shoulder are going to be in one line. You don't want their legs splayed out to the side necessarily. Too much?
Slightly.
Slightly? If I give you just a little pressure off, is that better?
That's way better.
There we
It's
go.
so intense.
Thank you for telling me it was too much.
Me.
Yeah. So really deep compression. If you have really tight calves, this may be difficult for you to do. I'll sometimes call this the nutcracker because you're just compressing them between your hamstrings and your calves. But it takes on nuance because you can kind of lean to like the left, lean to the right, depending on your legs. I don't like them right behind my knee. That feels uncomfortable. But if I go down towards my heels, usually that's a little bit deeper, I think. The absolute meanest would be putting them on your heel, which I don't know many people who can take that.
That would be so horrible.
Yeah. So if I go just a little bit
God, don't.
down towards your feet, or a little bit like up towards the knee.
I'm not ready to handle down towards my foot yet.
Okay. So if I hang out just a little bit above, is that better?
Yeah.
Okay. So I just shimmy just a little bit over to this side because she felt better. Really deep compression. I'm trying to think of instances where you wouldn't do this. Usually with some sort of tourniquet like this, I will tell students that you'll want to avoid people with a history of heart disease, stroke, blood thinning medications, Coumadin, that sort of thing. But for people who are robust and healthy, this is usually fine. People who had varicose veins or some sort of issues, with their leg, you wouldn't want to do this. But for people who are healthy, this is usually quite fine. You just have to make sure not to use so much pressure that they wince, which it's easy to deliver. This is where massage therapists confuse me. I'm like, why are they working so hard? Does this feel effective?
Yeah.
I try not to laugh too much because I'll bounce.
Yeah, don't bounce.
Yeah.
I can't handle it. But this is like one of my favorite things, even though it's so intense, it's so effective. I'm starting to feel a little uncomfortable behind my knee.
Okay. So if I lean just a little bit down towards your ankle, is the pressure too much? Okay. So if I take it off a little bit, is it taking the pressure off your knee?
Yes.
Okay. Yeah. So when she felt pressure behind her knee, and I'll just ask her for feedback, does it feel like your knee was hyperextending?
I don't know.
Okay. It just felt uncomfortable behind your knee.
Yeah.
Okay. Like you didn't want me to go that direction anymore.
No.
Is it too much pressure?
Slightly.
Slightly? You call me fat?
No. Calling my calves tight.
What I did to back off is I just pressed my shins down and used my quad just to engage to lift me just a little bit. Is that better?
So much better.
There we go. Now, can you move your foot at the ankle at all? And you can pull through it as much or as little as you want. When I do this, it just depends on the client. Some clients, if they just want to relax, you might not do that. But the active component for people in pain or people who are athletes is really beneficial for them. You dying there, Kristen?
Dying.
Dying? Too much?
No.
You want a quick break?
Yeah.
Okay. Has been enough?
No.
Not yet? I mean, I could go for another pass. What I'm saying is I could come off and just let kind of blood flow return. Okay, so I'm going to slowly. When I come off this compression real slow, it feels like you've crimped a hose and you want to just flush it out. If I just hop out, it usually feels like it's too much pressure, like it's too quick. It feels like the tissue recoils. How's this leg feel to compare to that one now?
Warm.
Yeah. Dying?
Oh, yeah.
Still sharp through there?
Yeah.
Yeah, right there. I feel that.
Yeah.